So I would say that fillers are not going to accomplish what a surgical neck lift will do. So the neck is really going to require some surgical repositioning. Other treatments, if you're not ready for surgery, would be either Uttherapy or Evoke, but filler is not really going to help. The main problem with the neck is not usually volume. So fillers are really going to replace volume. So they're not really, when we have the neck, we're talking more about the skin quality and texture, or we're talking about laxity. So we're not usually going to use volume to treat laxity. Things that will treat the laxity will either be things like Uttherapy, which is microfocused ultrasound, or the Evoke, which is radio frequency. Those types of technology are going to help to lift and tighten the skin. Filler is important, let's say if you have those necklace lines and you want to soften them a little bit, or we want to use some collagen stimulating procedures like Sculptra or Radiesse to help the quality of the skin itself.